The other day at work, we had a patient that was hypotensive. They had received a ton of fluids, and we were trying to figure out, like, do they need more fluids? Do they need a pressor? And a nurse said, well, why don't we try to do the passive leg raise on them? And I perked up so quickly because I love smart nurses. So let's talk about the passive leg raise for our tip of the week. The passive leg raise is a technique that we use to try and figure out if a patient needs more IV fluids. AKA, we are assessing for fluid responsiveness. In the ideal world, you do need your patient to be set up on like a flow track device or some other device that measures their stroke volume and cardiac output. And what we are going to do is we are going to lay our patient flat and we are going to elevate their legs at about a 45-degree angle for about 1 to 2 minutes. From there, we are going to assess if there is a 10% or more increase in stroke volume. If there is, that means that the patient would most likely be fluid responsive. If not, that means that we should probably stop giving that patient a bunch of fluid boluses because they are not actually going to do anything. How this works is the passive leg raise actually increases venous return in patients that are preload responsive, meaning preload needs more volume. Remember, when we think preload, we think volume. It's taking all of that extra blood and fluid that's in the patient's legs and kind of abdominal compartment. And when you raise their legs up, it is shifting that fluid up into the patient's upper body, AKA heart area. So if your patient is fluid responsive, you should see that 10% or more increase in stroke volume, meaning, hey, we probably should give this patient more fluid. If they are not fluid responsive, then you would not see that dramatic of an increase in the patient's stroke volume. So I thought this was a fun tip of the week. I love when we've got smart nurses, especially when they're working on my unit, and now you can be that nurse. So let me know if you have any questions.